Afternoon, everyone. Well, last year we held this seminar, an expo, at the Jewish Community Center in Boulder, and it was incredibly successful and very well attended. What a difference a year makes. This year we're hosting our first ever virtual expo and webinar series. My name is Al Manzi. I'm the president and CEO for Prairie Mountain Media, publisher of the Camera, and your moderator for today's session. Let me just welcome everyone to today, our third seminar. This one's on brain health, taking care of your mind and brain with functional lifestyle and functional medicine. Before I turn it over to today's speakers, please notice that there's a Q&A and a chat box on the bottom of your screen. If you take your mouse and go over the top of the bottom of the screen, you will see the Q&A and chat boxes. Please feel free to type in your questions in chat during the presentation, and that way our speakers, after their 40-minute presentation, will take about 20 minutes of questions and answers following the presentation. I also want to remind everybody that please visit dailycamera.com/aging. That's where you can visit the expo. I know you all went through the expo in prior years in the gym, and got to meet a lot of these partners, but they're very supportive, and please visit the expo at that location. Now let's get started. Speaking first will be Dr. Eileen Naomi Rusk, PhD, owner of Brain and Behavior Clinic in Boulder. Following Dr. Rusk will be Dr. Patricia Henry. In the interest of time, I'm not going to do long bios on those two people. They would take a long time. They're both very talented individuals. So first, I'll turn it over to Dr. Rusk to get us started.
Great, thank you. Just going to share my screen with all of you. Great. Beautiful. Perfect. So welcome everybody. We're happy that you're here. The circumstances aren't great, but we're making the best of it. And we're all learning and growing during this time. And we're here to talk to you about taking care of your mind and your brain using a functional medicine approach. And some of you are familiar with this approach and some of you aren't. But I'd really like to start with basics. And I'd like to begin with describing Alzheimer's disease as a chronic brain disorder. It's also called a neurodegenerative disease. And it does often begin with memory difficulties, but it doesn't always begin with memory difficulties. It can actually start with other types of cognitive complaints. Eventually, over time, it does affect all aspects of cognition, but early on it doesn't. And I'd like to describe to you the umbrella term dementia. And dementia is an umbrella term, and under that umbrella term is Alzheimer's disease. You'll see on the left of the slide, that comprises about 70% of all dementias. So it does get diagnosed more readily, but I also want to let people know that it's very important to know that things like depression or chronic grief, frontotemporal dementia or vascular dementia, these are all things which can contribute to something that might look like Alzheimer's disease. This is me in the 1980s looking for a simple single cure. All of us were doing that in hospitals and labs all over the country. For the last number of decades, we've been looking for a small targeted strategy, a small simple pill that would cure Alzheimer's disease. And what did we find? Not very much. We've used all kinds of strategies to try to find a single targeted medicine that would cure a complex illness like Alzheimer's disease. And it turns out that we have not been very successful at all. Some of you are either on these medicines or have heard of them, but the main targets of treatment have been to reduce the breakdown of a specific brain chemical that's been said that is involved in cognition, acetylcholine, And that's ARICEPT and other drugs like it. And there's also NAMENDA, which alters another neurotransmitter called glutamate. The only problem is these medicines do not cure or get to the root cause of Alzheimer's disease or any of the other brain disorders. So we need to look at it a different way. We need to be focused upon the universe of possibilities for what might cause cognitive decline, what might cause Alzheimer's disease. And we're very fortunate that a new model has emerged. In 2014, a wonderful paper was published in the journal Aging by a mentor of mine and the team who work here, Dr. Henry as well. And he described a lot of work that he had done over the last 30 years at UCLA, studying the metabolic underpinnings, the root causes for what might be causing something as complex as Alzheimer's disease. And indeed, there were many, many root causes. So we've moved from looking at it like, what is the tiny possible cure, to expanding our view and looking at all of the possibilities within a human body, within a lifestyle that may contribute to cognitive decline. And actually, I think this was a pivotal paper, and he's still a pivotal mentor of mine because this is his philosophy. Our brains, when they have an illness like Alzheimer's disease, are like a leaky roof that has many permeable things that need to be sorted out and repaired. And you'll see from our presentation that all of these things are within your hands. Things don't cure an illness, but the point is we have to look at the picture. So this is meant to be a funny slide. You're not supposed to be reading everything on it, but this is from the paper that Dr. Bredesen published in 2016, showing all of the different contributors to Alzheimer's disease and all the things we need to work on to balance. That means lifestyle changes. I highlighted a few to share with you. You see in red, increasing autophagy. That just means having some periods of fasting throughout the day, or having a long fast in the middle of the day. Increasing BDNF is another thing that I've highlighted. You can see that BDNF stands for brain-derived neurotrophic factor, and that is something we can really modify in our lives by upping our exercise and making a really big effort to vary the exercise and increase it. Enhancing detoxification is something I've highlighted because that's something that Dr. Henry is going to be speaking to you about as well. So I've created a brain health map for you, and everything that you see here in red are things we're going to touch upon today. These are all modifiable factors that each of you can change after you hear this presentation. My invitation to you all is make a commitment to change 2 things today. So as you're going through our presentation, which is information dense, so don't worry, you can go to our website. We're going to send you all a handout at the end of the presentation as well. But make a commitment to yourselves. Make a commitment to take care of your brain health, to work on prevention strategies, or if you're having cognitive decline, to take action. This slide is in here because it's really important to talk about this as a family affair. There are several studies that show that if you're living and caring for somebody who has Alzheimer's disease, your chances of getting Alzheimer's disease or some form of dementia increase exponentially. So this is a particular shout out to the caregivers to take care of themselves, take care of yourselves. And these are the reasons to start early. You can make the biggest difference if you start early. Our brains are like a garden. They want weeding, they want tending, they want healthy fertilizing. And these are many of the components that you guys can work on and that we work on with our patients in our clinic to help reduce the likelihood of getting cognitive decline and working on it if you do. Another main principle here is neuroplasticity. Neuroplasticity means the tracts and pathways that you use a lot in your brain get rehearsed and grow. Those which you don't use, prune away. That's just normal brain function. But now we know we can captivate neuroplasticity and create positive changes. So brains are always reacting to our inner environments, what's going on inside of us, metabolically, physiologically, psychologically. Our brains react to everything that goes inside our bodies, and our brains are always changing depending upon the environment that we're in. So I'm inviting you to choose your environment carefully and just become more brain aware. Here's some of the internal factors that can cause cognitive decline. Blood pressure changes, refined sugars, diabetes. The health of your heart very much impacts the heart of your brain. And many of you in the recent years have heard that inflammation is a very big contributor to cognitive decline. I put inflammation and infections together because sometimes they go together as well, although there are many other reasons for inflammation as well. Studies show that midlife hearing loss increases your likelihood of getting cognitive decline. And so that's something that's a very modifiable risk factor too, but please notice, as well as metabolic issues, but notice again, I've highlighted these things because depression, anxiety, unresolved traumas, grief, distress, even boredom contribute to cognitive changes and indeed can increase your likelihood of being vulnerable to Alzheimer's disease. And here are some external factors. The external things that you can modify in your environment. And remember, today we're asking you to take away 2 things that you can change, that you can commit to today. Because during this time of COVID, to be quite honest with you, all of our routines have changed. We're socializing much less, we're stimulated much less, and we all know that those are risk factors for cognitive changes and cognitive decline. So again, be aware that there are things you can still do at home and many, many resources to stay cognitively stimulated and to eat well and to sleep well. So lifestyle is key, and that's our point. Creating routine, especially during COVID, is very, very important. And that means having a rhythm to your day that includes exercise, that includes eating well, that includes structured meal times, structured socializing time, creative time, time to be in a place where you feel inside, joyful, stimulated, challenged. And now we're going to give you some ideas specifically of what you can do. Moving your body for your brain is key. Regular physical exercise can reduce your risk of developing Alzheimer's by 50%. If a drug company would have found that pill that reduced Alzheimer's by 50%, you know that we'd all be thrilled. But we have the capacity to do that in the comfort of our own homes, in the beautiful mountains that we live in, and we offer our patients certain kind of tricks. The literature shows, the science shows that if you combine aerobic exercise with some resistance training and weights, that's even better. If you combine exercise with physical exercise with cognitive training for your brain, that helps even more. The key is to warm up, vary your exercises, and don't forget that I'm putting yoga in 2 categories. Yoga fits in the category of physical exercise and a stress and relaxation exercise. Actually, I'm going to add a third. And the third is soothing for the soul, but it's also good for balance and self-awareness inside your body. So these are the main types of exercise we talk about. Aerobic exercise, weight training, balance training, but then I'll put yoga in there as well. And high intensity interval training. And all of these exercises, if you're going to make any big changes in your exercise routine, make sure that you speak to someone who knows your body. And if you know your body well, then just trust it as well. Exercise your brain too. one of the most important modifiable risk factors for dementia is lack of cognitive activity. That's not something we think about every day, is it? But there's so many things that you can do, like find a new recipe, study a new country, get really curious about brain games. I don't advocate brain games as the only source of cognitive activity, and some people misunderstand that. Cognitive challenges and stimulation ought to be happening throughout your day. Stay brain aware and aware of when you're feeling a little challenged, not to the point of stress, just to the point of stretched. So there are some very valid and reliable online cognitive training tools. I'm not going to mention any proprietary names right now, but we're more than happy to help you out at another time. The key is mix up your cognitive training and make it interesting for you and engaging. A new piece of literature just came out that might interest you all. That piece of literature, and there are many, showing that stress, worry, and negative thinking actually have a physiologic impact. Sometimes just to imagine that our negative thinking actually has a biological footprint, if I can use that word, in our brains is actually quite interesting, isn't it? I want you to start thinking of your thoughts, your mind, dealing with stressors or baggage that you've carried that you no longer want to carry. Aging is a wonderful time to offload baggage that you no longer want to carry. Gripes, sadness, disappointments. This is a great time for healing our elder years. And just as an example, I found a study that showed that repetitive negative thinking is associated with an increase in amyloid and tau in the brain. And those are often associated, amyloid and tau are often associated with the pathology in the brain of people who have Alzheimer's disease. And this was in people who did not have dementia or Alzheimer's disease. They hadn't been diagnosed. So that's a very interesting thing to think about, isn't it? And it's mind over matter. So become more aware of your mind, your thoughts, how you're reacting to stress. Many of us live at this kind of ebb where we don't feel we're stressed. And I think during this time of COVID, pandemic, less social connection, we've become a little bit more aware of our minds and how we think. Now's a great time to start all kinds of mental training, but I put meditation in this category as well. Another great opportunity to know your mind, either through breath work or work with stillness in the mind. And there are many, many online available resources for you. And of course, practice good sleep. Most of you know these wonderful sleep hygiene habits, but I'm going to encourage you again to focus on sleep. Something you may not actually know about would be that we also want a cool room. We want a dark room and a cool room. And waking up at the same time has been shown to be just as important as going to bed at the same time. Try not to eat before bed. That's another really important point for brain health. And that goes back to the slide of the roadmap when I talked about autophagy. So that's a functional medicine model. I've just described some of the pieces in the functional medicine model: building emotional strength, building cognitive reserve. I talked about sleep and mobility and physical activity. And now Dr. Henry, who I work with, is going to be talking about toxins, nutrition, and you'll enjoy her talk very much.
Hello. I'm so glad to be here with you all today. And I hope you all are well. And we're sharing a lot of things here that should help you be well. And Dr. Rusk has named off a lot of things that can impact your brain health and your general well-being. uh, under the umbrella of the things that affect cognition. She talked about Dr. Bredesen and his discoveries that there may be a lot of holes, potential holes in the roof that contribute to cognitive decline. And then Dr. Bredesen, in his work, connected with this concept of healthcare, it's kind of a framework of healthcare known as functional medicine. And what he discovered was that this framework worked beautifully with what he was finding in his research, because it's root cause medicine. It's about getting to all those little pieces within your lifestyle that contribute to cognitive decline. And looking at the slide, you see there's 7 keys to functional medicine. Nutrition, what you put in your body. Your hormones play a big role. As we grow older, we have changes in our hormones. We're not going to get into that today. That's a lot of what we do in our office, but it's a very important piece to why sometimes when we start into changes in our 50s and 60s, our brains seem like they're not online as well. Again, inflammation, we're going to be talking about reducing that in terms of your toxic burden today. There are other things that contribute to that, such as infection, chronic infection, environmental things, which we'll be talking about with toxicity. Your digestion, you need to be able to assimilate your food and the nutrients from it, and that changes as we grow older as well. We're not getting deeply into that, but remember, take your time when you eat. Chew your food well. Be in a relaxed state. That's very important to consider. And then we'll be talking about that whole concept again of detoxification and what comes in and what goes out and how to optimize those things. And functional medicine also deals with energy metabolism. If you are nourishing your body well, moving it well, then the odds are the little powerhouses in each one of your cells, you might have heard of the term mitochondria, function better and they multiply. Dr. Rusk also talked about the mind, which is such a huge piece. The state of your mood, your stress levels, what has gone on in your life, and how you choose to express it and deal with it. So, I'm not familiar with how to use your, okay, thank you. Okay, so this is a kind of a busy slide here, but it gives you an idea of so many of the things that go into cognitive decline. Like I said, I'm going to be addressing a lot of things with the toxins. As you see, that's a big contributor. We're going to be looking at the gut and that gut-brain connection, what goes on with that. But as you see, these are the things within this whole matrix that contribute to cognitive decline. And these are things that we do in our office. We kind of look at you and try to figure out what your holes are in your roof. But today you can really begin doing some major pieces to it, some very simple major pieces that influence whether or not you are going to go down the road of having symptomatology related to cognitive decline that comes from some of these issues. Here we go. Fundamental, fundamental, fundamental. You got to reduce the bad stuff coming in and increase what goes out. Very basic. Remember that. Think about that. Because what happens as time goes on, in the beginning, you're pretty healthy, you're younger. As time goes on, your toxic bucket starts to fill up. You start to have the beginnings and the signs of some of these diseases or these symptoms that are concerning. You just don't feel or think the way you used to. And if you wait too long, that toxic bucket fills up, it overflows, and you have a full-blown disease. But we have a wonderful body that is capable of managing those toxins. The objective is to make sure we're not putting too many in and we're getting rid of what comes in. And we have some great mechanisms to do that with. how we breathe, how we eat is another thing. But there's some very, very basic things. We've got, we need to be able to get rid of what comes in and what goes out. So we'll focus right now on the air. As we know, we have a lot of pollution in the world. And actually our homes, when you're spending a lot of time in your home, as well as in your workspace, make sure that you have filtration, air filtration of some type to help reduce that burden. A high quality HEPA air filter is ideal. There's a great website, which we have here, www.ewg.org, which will assist you in finding better cleaning products for your home and your workspace to make sure they are safe yet effective. And there's a rating system they have on 1 to 10. I try to make sure as much as possible, everything that comes into my environment is 5 or below, as low as you can get it, but making sure within your price range that you can get them pretty safe within that 1 to 5 range. So when you exercise outside, try not to do it by auto exhaust and industrial and pesticide treated areas. An area to be concerned about is golf courses. Being careful not to be out there right after they're spraying. It's very important because that is part of the toxic burden you're trying to avoid creating. And when you buy new products for your home, make sure you give it time to air out, open the windows, use your air purifier because you're breathing in all the off-gassing of toxic chemicals from plastics and rubbers and all kinds of materials that tend to need to be aired out before you're living with those items. Water, another easy thing that you can do. You can get a good water filter. I suggest you get one that is pretty high quality. You can get those for around $300 and it ends up being much more cost efficient long-term than just your Britas and much more effective. You need to have the multiple stage filtration to truly get rid of the chemicals or reduce them to the level where it's truly making a difference. It may seem like a big purchase, but it's very much worth it. Also consider getting a shower filter. You just screw it onto your shower head and it will reduce a lot of that chlorine and some of the other toxic chemicals that actually get absorbed through your skin. So remember, we're talking about reducing. We're not talking about being perfect. We're talking about reducing what's coming in. And when we think about food, we're thinking about getting clean food, organic and non-factory farmed as possible. Whatever you get, organic or conventional, make sure you wash all your produce, and a good baking soda solution works really nicely for that. And read your labels. Labels will tell you a lot. You want your foods to be as real as possible. Oftentimes when things have big long lists on their labels, you probably shouldn't be eating those things. Real food is close to the way it comes from nature as possible. That's where the majority of your food should come from. How you store your food and what you cook it in is very important too, because when you use plastics, that will leach into your food and add to your toxic burden. The same way with cooking, you want to avoid the Teflon type cookware, go more for the stainless, enamels, those things, those types of surfaces that are not leaching into your food. Again, I love the EWG.org site. When we're talking about skin, that's another place where we will start absorbing toxins. A lot of the products out there, you look at the labels and you can't even pronounce half of the words. So the EWG site will give you an opportunity to study and look at what products are safer and change your products. See what you're using. If it's really high, change it out. There's so many great products out there that are not that expensive that are pretty clean. and effective. So now let's talk about how to get rid of what comes in. We want you drinking lots of water, at least half of your weight in water a day, or fluids, good clear fluids. And that may sound like a lot, but really it's not. That is very important for hydrating your system and having you pee out a lot of the toxins. Pooping, very, very important. We want you pooping. We don't want it to be rocks. We don't want it to be diarrhea, but we want you eliminating your digestive system and through your colon and through your kidneys. These are major, major organs of detoxification. We need to be making sure that we're processing what comes in. An area where I feel like a lot of people these days avoid detoxing is sweating. We don't like the sweat. I'm here to tell you and ask you to start enjoying sweating. Get out there, exercise, saunas. There's studies that show that people who sauna regularly have lower incidences of cognitive decline and Alzheimer's. Very well documented studies out of Finland. So I highly recommend any opportunity you get to sweat, to sweat. And you just wipe it off, you take a shower afterwards, and then you hydrate. Breathe deeply. Please exercise and deep breathing using your full lungs. This is an exit point of toxins as well. Use it, enjoy it, and you will find you will feel better with it as well. That brain-derived neurotrophic factor that influences your mood as well as your cognition. And of course, there's the nutrient-rich foods and supplements that support all of these pathways so that your body can actually change toxins into water-soluble elements that will come out. This is what your liver does. And if you're not bringing in enough of the good nutrients that come from real food, like fruits and vegetables and good clean meats, then your body will struggle. So just to keep it simple, and I want you to think about making new habits, the little habits that we do every day, that goes with every meal. Think about these 3 areas of food that you can get rid of. Think of them as poisons. Sugar. Sugar is something that hides under many names in foods, but eliminate it the best you can. Try to reduce, reduce, reduce. Industrial seed oils, this hides in many things, especially if you buy like salad dressings, hides in there all the time. When I say industrial seed oils, that means things like soy, canola, sunflower, safflower, cottonseed, corn, vegetable margarines. These are not meant to be as concentrated as they are, and they have inflammatory fats within them. So switch over to things like olive oil, avocado oil, and even butter if you tolerate dairy. Ghee is a nice fat. Refined grains, that's the flours. That's the things that you'll find in your pastas and your cakes and your breads. Your body treats that like sugar, and you need to think about reducing that to have a healthier diet that's brain healthy. Do you need to be perfect? And that's where a lot of people struggle. They think, I can't do this unless I'm absolutely perfect, and they beat themselves up if they're not. I'm here to tell you that for most people, the 80-20 rule works. It works beautifully. The majority of the time, and what I do in my household, I try to make my household food as close to 100% clean as possible. So that gives me wiggle room when I'm eating out or eating at someone else's home, so that I can have a little bit. I can have some of the foods that I know that restaurants aren't doing in good clean fats. I know that I can have some of the more inflammatory prepared foods that might be fried. but I avoid those otherwise. I stay away from grains as much as possible, but if I'm out and rice is being served with my meal, I will eat the rice. So for me, it's about keeping my household not eating out every day. I eat out maybe once, twice a week max, and then I have some wiggle room, and I don't have to be stressing about it as much. But it's something each one of you can do. It's habits. It's changing habits, little habits at a time. So now the other thing to be thinking about with this, when you're thinking about food, you have to understand there's this crosstalk that goes on between the gut and the brain. They talk to each other constantly, and you know that. Think about the times when something upsets you or scares you. Sometimes you get a tummy ache. Sometimes you may get diarrhea. So we know there's a lot of crosstalk that goes on there. Sometimes you can eat something and you feel like you have brain fog immediately afterwards, or even a day afterwards. Sometimes it's hard to know what food is doing it to you. But you have a nerve called the vagus nerve, which is one of your cranial nerves that comes from your brain all the way down to your gut and constantly talking back and forth. So we need to be thinking about that and how that influences things like inflammation in the brain. And we also know that a head injury can influence the gut. We have barrier systems in the gut as well as in the brain that help to prevent bad stuff from passing through, but they can become leaky. They can open up, these little tight junctions can open up and let things pass through that should not pass through. It's stress. All of these are stressors. You have emotional stress, you have environmental stressors, you have dietary stressors, and it's about reducing the level of that so that your brain has a better chance of staying online for your whole life. So to summarize what you said, I'm going to turn this back over to Eileen so that she can incorporate her work with my work that I've talked about and talk about what her office does to help and assist as well.
Don't you just love hearing Dr. Henry present? I know I do each time. So Dr. Henry talked a lot about the relationship between the gut and the brain, healthy foods, clean air, clean water, all the things that you can do around your own homes to reduce toxins and then to release toxins as well. And to summarize what we said, you have complete control over your sleep. Now, if you have sleep difficulties, it's great to get help, to talk to your doctor about sleep, to check for sleep apnea. This is a huge contributor to cognitive decline. But there are many things you can do to better your own sleep. And you can expand your movement each day. That's another thing we talked about. That's a big contributor to cognitive health and challenging your mind, exercising your mind. We talked about calming your mind, and that was a thread through my talk and also Dr. Henry's. When we calm our minds, we even benefit our gut. We also have the ability when we meditate consistently to change the size of different brain regions. So the key is to mix it up, stay interested in your life, stay engaged with your everyday life, and socialize as much as you can, even during these difficult times. I'm sure many of you are on Zoom and other platforms where you're connecting with people, but that's really a priority. Meaningful connection is very important right now. We talked about reducing toxins, and Dr. Henry did a beautiful job talking about keeping your diet clean and focusing on anti-inflammatory foods. So we have a healthy brain checkup that actually screens for a lot of things at our clinic. And this is a slide just showing the kinds of interventions that we do and the things that we look for when we do a very comprehensive, just an assessment to begin with, and then a treatment protocol if it's right. So thank you very, very much for being part of our presentation. And we want to let you know also that if you go to this website, eileennaomirusk.com, There are many free brain health tips, and we're posting articles on that site very often. And we're also going to send you a handout that summarizes some of the things that Dr. Henry and I spoke to you guys about today. So thank you very, very much for being part of this talk today. And then I'll hand it over to Al, who I think is going to have some questions organized for all of you.
Well, I've had the pleasure of listening to you both several times, and it's always fascinating, and I'm always quickly writing down notes myself for things that I need to change. But I want to encourage everybody to take the time to look at the bottom of their screen too, so they can ask some questions, because that's a big part of this. And they're wonderful at the question and answer session. So I'll get it started, and then we'll start looking for the questions from the group. You constantly see supplements being advertised on TV about brain health. Can you talk a little bit about supplements, and is there a value to those supplements in terms of preventing cognitive decline?
I'm going to answer half, and I'm going to let Dr. Henry answer the other half. The first half of the question is, there's a reason we didn't put supplements on our talk. We think that there are many things that people can do that are extremely effective. There are some basic supplements that we hope that all of our patients are on, but the key is the low-hanging fruit. And those are things that you can do in your everyday life. I don't want to minimize those things that we have control over and that will enhance our lives. As to the specifics, there are some specifics. Just like you hear about for COVID, there's specific things that people are recommending for immune health. But again, it's a long-term lifestyle thing that we're emphasizing here. You're welcome to add.
Yes, so we want the pill, the magic pill.
We're still thinking that way.
Yes, yes, and supplements are just that, supplements. And yes, there's a lot of great things out there, and we do use a lot of supplements in our practice working with patients. And they are, many of them, very effective, but we do testing. Yeah, if you're not testing, you're guessing. And for some things, you know, you can guess pretty accurately, but our philosophy, if someone is starting in with some major changes, we need to know what's going on with their physiology.
Yeah, and specify. The key to what we do and what we believe in is personalized and precise.
Yes, and the other thing, of course, is considering quality control. There are a lot of supplement companies out there. Some are better than others, and there's always the question of what actually being absorbed. So some supplements are. So we do our best to try to understand what's going on digestively for you, as well as biochemically, so that we can kind of match you up the best for the best products.
Interesting. I know there's a lot of people who have a family history of cognitive decline. Are you recommending any medications that they go on early? Because I know there are some supplemental medications now that they're talking about that can slow cognitive decline in people who have a family history of it.
I'm going to go back to diagnosis, because just because you have someone in your family who had cognitive decline doesn't mean that they had Alzheimer's. They could have had cognitive decline because of alcoholism, depression, many other reasons. So again, I'd start off with getting accurately diagnosed. Some of the medications that, and it depends there are some risk factors from a genetic point of view for Alzheimer's disease. And when patients come into our clinic, that's one of the first things we screen for. That's probably the best way to start to answer your question. And there are things that you can do if you know that people have 2 copies of ApoE4. So yes, there would be some particular things that we would do in terms of diet and supplements if we knew someone had an ApoE4 double allele. That's right. Is there anything else you want to say?
Yeah, and again, you know, we just need to get away from that idea of a medication, a pill. Yes, they can be helpful, but that's what we're all looking for, is a quick way of, so that we don't have to make those little habit changes in our lifestyle. And unfortunately, we're trying to teach, I shouldn't say unfortunately, you kind of start thinking of it as a good thing, where we are changing what we do on a daily basis into healthy habits of lifestyle.
And I want to say that we do know of medicines that are offered for Alzheimer's disease and cognitive decline, and support those people being on the medicines that they're on from their doctors. We're just saying it doesn't approach a root cause. That indeed, ARICEPT, for example, which many of the listeners are probably have heard of or are on, it does modify maybe the length or the symptoms for several months. I think the clinical trials show several months. They don't work for all people. And again, it doesn't address some of the root problems.
Interesting. We've got a bunch of questions, so let's try to move through them. This one question says that she has toxemia with her pregnancies, 4 out of 4 children. Does that mean that she has a 70% chance of getting vascular dementia? Is that true?
Did you want to talk about that? Those are statistics from a study, and our belief system based on good research is you can, according to Dr. Bredesen, if you can identify the physiologic and environmental things that are influencing and you to be predisposed, that you don't have to be in that 70%.
That's right. And the model that we talked about today would be a similar model for that woman who's concerned about major vascular changes. It's very realistic for her, and her likelihood of suffering vascular problems later on might be greater, but it would be, again, good to look from a root cause approach.
So many things you can do to support vascular health. Yes, yes.
And she might want to see a functional medicine doctor.
Excellent. In fact, there's a question about Dr. Bredesen protocol. Is someone in your office certified in it? My guess is you both are.
We both trained. There are 4 of us who've trained actually with him. And just know that we work with Dr. Bredesen's model, and we do a lot of other things as well.
And do you take insurance is one of the questions.
We don't take any insurance, but we have a healthy brain checkup appointment that allows people to, if they don't have insurance, that's a private pay appointment, but it allows people to have a roadmap going forward. At the end of that appointment, I, for example, will refer people to people who take Medicare or to people who take insurance. And I'm not sure about submitting our appointments to your own insurance.
Okay. Some people have questions like on food, specific foods, like how do you feel about dark chocolate as a brain booster?
Dark chocolate for most people is high in antioxidants. For some people, it can be a wonderful food. Just like any food, one person's great food is another person's poison, so to speak. But dark chocolate, it's very good. It's a very good food, not taken to extreme. Yes.
And another question about CBD and marijuana, because we've had some people ask questions about sleep and difficulty sleeping, and marijuana is a sleep aid and a stress reducer for some people, and CBD oils now are being used heavily by the older generation for pain relief. So can you kind of talk about where your practice is at with all of that?
We don't specifically recommend that people take CBD or THC, but we know that it's fabulous for inflammation. It's great for sleep. It's a wonderful, separately. I'll speak about them separately, the THC and the CBD. The CBD is the non-psychoactive cannabinoid. But we have say nothing bad about CBD or THC as long as it's prescribed well.
Yes.
It's also been shown in some studies to benefit Alzheimer's.
I've recommended it to numerous patients for sleep.
And I know you covered some of the specifics on anti-inflammatory foods, but we've had more questions about, could you be more specific about anti-inflammatory foods?
So, that's the difficulty of having, 40, 45 minutes. That's a whole nother talk. We would love to do that talk.
We've
Yes.
still got a few more minutes, so if you can give them some examples, I think that would be helpful for them.
Whole. So real food.
Whole real food
means well-raised, well-prepared meats and fish. When I say well-raised, that means grass-fed, grass-finished meats, eggs that are pastured. I mean, getting as close to non-factory farmed as possible, because that process introduces, unfortunately, things like antibiotics, and the practice of how they're raised changes their nutritional content, but doesn't mean that there's still not value there. It's how you prepare it, whether you're going to fry it in industrial seed oils like soybean oil, or prepare it nicely, heating it gently and preparing it that way. Vegetables and vegetables, and fruits to a certain extent are very good. Too much in the way of fruits, your high sugar fruits, become inflammatory because the sugar content becomes so high. And we have hybridized so many of our fruits to be sweeter and sweeter and sweeter. But real food with each meal, as opposed
so fruits always get that rap. So be more. Could you be a little more specific on fruits? So
berries are wonderful.
Organic berries specifically, because non-organic berries hold the most pesticide and fungicides of any fruit, I believe, and cover a great surface area. So it's really important to get organic berries, but they're great. And
did you know an avocado is a fruit?
Mm-hmm.
So that's probably one of the best fruits you can have. And
what about healthy breads? I mean, a lot of people feel like, okay, well, I'm eating a healthy bread, a 6-grain or an 8-grain bread versus a white bread.
You're right, Al. And we're at a point now where we've changed the composition of our wheat so much, and so many people are gluten sensitive and gluten intolerant, that there's not necessarily a good bread.
See, one of the things that's happened with a lot of our grains is the way the farmers are preparing it for harvest is they spray it with glyphosate to have it dry out quicker. So there's many things that are contributing to why suddenly people were having all these issues with grains. It's more the farming practices than anything. And the thing with whole grains is, yes, it does slow slightly that glycemic load, because basically bread is sugar. It will raise your blood sugar in the same way a spoonful of sugar will. And so it slows it slightly, that big spike, but it still is there. Then the other thing is, in terms of the pesticides and the heavy metals, the whole grains, what we're finding is in the hulls that tends to sequester a lot of the toxins. So doing your best to do organic would be a better thing, but also understand that we were not meant to be consuming as much as we tend to. Every meal tends to be grain centric in some way. Breads, rices, potatoes, and there's real food. The potatoes can be fine. The sweet potatoes are great, depending on the person, how much. Again, there's a lot of individuality here,
But yeah, generally.
We've got a question too about how is your practice doing under the COVID restrictions? Are using telemedicine more? How's that working remotely for you?
Well, this is the closest we've been in a good number of months. We're doing everything, including our neuropsychological evaluations, remotely, so there's no doctor-patient contact at all. We've had wonderful success. It's actually very, very, there's something very sweet and close about doing the telemedicine we do. And I know Dr. Henry can speak to that. So we're doing all of our assessments. The only thing that we don't do is, I'm not sure what the labs are doing right now. I don't think a lot of people are going to labs and getting labs drawn. That's a very relevant question because people have been doing a lot of non-essential services now. We're starting to open up, so we'll see what happens with that. But we're doing everything by telemedicine, including a healthy brain checkup, including neuropsych evaluations.
Interesting. We got one question from a gentleman who says he's taking Dr. Perlmutter B, D, and F supplement
Right.
that he's taken for quite a long time, and it increases his energy. He says he's 77 without signs of dementia, but he's afraid to keep taking it because he worries about the rebound effect, such that my brain gets used to the extra B, D, and F. Is this valid?
It's a smart way to think. I'm so impressed with his thinking. But remember, we told you there are many other ways to increase BDNF. So if that gentleman wanted to increase some things that he did in his life, like exercise differently or vary his exercise or eat certain foods, or then he'd be able to kind of increase his BDNF normally or naturally. And then he, along with whoever he's working with as a healthcare provider, would taper off the BDNF slowly.
Well, and Dr. Perlmutter's formulation is a lovely formula. It's just basically fertilizing the soil.
Right.
So it's not one of those things in terms of
like an
creating
antidepressant.
It's not causing a down regulation of what's already happening. It's a good product. Yeah. So.
Excellent. Let's talk a little bit about sleep because we had a couple of questions on sleep supplements, because many people have a difficult time falling asleep or staying asleep. And maybe you could give some recommendations on things that they could do without the supplement, and then also maybe speak about the supplements themselves.
Yeah. Creating routine is very, very important for sleep, and people underestimate how important it is to structure sleep into the daytime routine. So it's almost like I recommend that my patients, we start thinking about sleep in the morning. So calming your nervous system, if a baby is really, really stimulated and you take a new baby to a fair and a festival and you think, oh, I'm going to tire that baby out. And then you try to put that baby to sleep, they don't go to sleep. Well, our nervous systems work similarly. If we get really activated and we're very stimulated, we're very aroused in terms of our sympathetic nervous system is very excited, it's very, very hard to fall asleep. So planning sleep and creating rhythm and routine before bed, and that means not exercising in the afternoon or late afternoon. Many people that doesn't work for. It also means creating a ritual. For example, a plan for before you go to bed, not to eat before bed, to have a long gap between when you eat and at least 2 hours, let's say, a gap between when you eat and when you go to sleep. For some people, it's taking a bath. I'm giving you some of the lifestyle things that everyone can do. A key is to reduce the amount of light exposure that you have after a certain time of day. And that includes computers. And we're all so familiar with computers, we forget that blue light, all of it is this blue light. So it's important either to wear orange, yellow glasses, or to turn your night setting on your phone and your computer, or not to watch it at all after a certain hour. Some people take a lot to bed with them in terms of worry. And I recommend that after dinner, not right before bed, but after dinner sometime, before you're preparing to go to bed, or just as you're beginning to prepare, write down a few things that you don't want to take to bed with you, that you want to put on a piece of paper or on a journal next to your bed, and commit those worries to 7 o'clock the next morning. Say, I can still worry about those, but I'm just going to have a pause now while I sleep. And I promise I'll pay attention to this list when I wake up the next morning. And that way, structure. Yeah. And about the
supplements. That's great advice. We've got two more quick questions. One is, are gluten-free breads better than regular breads? Even if you don't have sensitivity?
If you don't have sensitivity, no. No, the issue is when we're talking about reducing the grains in our diet, it's more from a blood sugar standpoint, but yes, it's good to, gluten tends to be a inflammatory food for many people. It doesn't necessarily mean that you have celiac. It could be gluten sensitivity. It could be many of the other ways that you can be sensitive. So in that regard, it would be better than regular wheat bread, but it's still an inflammatory food because of what it does to your blood sugar. So it's one of those things you limit. Yes.
Got it. And then antidepressants, do you prescribe them and other medications? One person asked in your practice.
That's a good question. We don't personally prescribe antidepressants. We work with people who have depression all the time. We don't prescribe antidepressants. We refer people to good people who prescribe antidepressants. And again, there are many things that affect depression, from diet to sleep, to old traumas, to old kind of nervous system habits that we love to work with people on, but we ourselves refer out to for the prescribing.
Well, we're out of time. As usual, your session was just so informative and so interesting and so much fun to listen to. I'm sure we all got a tremendous amount. We will all try to take two things away from it, as you said earlier. So I want to thank you all and everyone on this that's viewing this seminar. I want to remind everybody to please go to dailycamera.com/aging to check out the expo and support our partners. So once again, thank you very, very much for a terrific session.
It's a pleasure. And we'll be sending out a handout through your website so that people can get a summary.
Wonderful. Thank you so much.
Thank you.
Bye now.
Bye.